We are joined now on the line by an addiction specialist with some concerns about today being the last Wednesday of the month and the possibility of a spike in overdoses because of COVID-19. Nirmala Raniga joins me on the line, again, an addiction specialist. Thank you so much for taking some time with us.
Good afternoon, Jill, and thanks for having me on the show. And, these times are very important and critical to get some message out to our community.
What are your concerns then with today in particular and the possibility of overdoses?
Well, as we know that, every month we have the Welfare Wednesdays, or the checks come out end of the month. And with COVID-19, we know the borders have been, there's been a lockdown, people are not crossing the border. And, there's people who are holding on to probably fentanyl and other drugs and check issue. And we know in Welfare Wednesday, the Thursday, Friday, the risk of overdose increases. And with COVID-19, it's like a double whammy in a sense that, here we have people who are in downtown East Side, even in Simi and different communities, the marginalized, vulnerable people who are, addicted have, there's a greater risk on two levels. One, there's no, there's no social distancing there or isolation or physical isolation. It's a community, while addiction really, when we think about treatment and healing, we want that connection. We want people to come together to heal when they're addicted, because addiction is about isolation. Here we have to practice the opposite, where we want people to isolate. Where will they going to go? They can't isolate. So we have on one level a greater risk of the spread of the virus in that community. And on the other hand, we probably will see more people overdosing. And that's the great concern.
And also, with frontline workers are stretched to the limits and feeling a lot of stress dealing with this. I talked to a doctor, I think it was last week, about this, saying he was concerned as well that the black market was going to take off because of hoarding and because of a shortage of other drugs. Is that something that concerns you as well?
Absolutely. There are people out there, there are predators out there, I'm sorry to say, that they wait for this kind of moments and they take advantage of the marginalized, the vulnerable people on the street. And it's very sad for people like us who work in this field that, there is help for those who are seeking help. But, when you are living in that community, sometimes you are not you're not opening your door to get that help. And I'm sure there is help available, those who are listening, that there are doctors, there are clinics like ours. There are many clinics who are willing to help. If this is an opportunity, I see if somebody wants to get on the treatment programs, recovery, people don't have to come in person. We are also maintaining that the physical social distance. All our clinics are open. The staff are there. The physicians are coming in. And if they're not coming in, they're all doing this through the phone to continue to support those who need help.
And is that message getting out, do you think, to the people, specifically to people, to let them know that, yes, there are still services available and it can be done with the rules of physical distancing?
Absolutely. We have, our staff have been calling patients who are on the program, because there's this fear that if the clinic's not open, how will I get my medication? So we have been doing that. We have been calling patients, letting them know, don't come, don't put yourself at risk. The physicians, if you need to talk to the physicians, we will make that happen. Your prescription will be at the pharmacy. And we are really there. Even the College of Pharmacy is supporting the pharmacies to also do deliveries to, if patients can't make it to the pharmacy because of this risk. So everybody is really open to the idea of supporting those who need help. The person has to show up or call. And these are very, very tough times for everyone.
Right.
Our staff, I know our clinics, we have 5 locations. The staff have been working super hard to support the patients, and there are other clinics as well and doctors who are doing this, and all the healthcare providers, whether it's COVID-19 or addiction. We need to show up and support, and we need the community, to listen to the message, whatever that message is right now, is to practice that isolation, the physical distance.
All right. So I'm sorry, Nirmala. We'll have to leave it there. We're right out of time. Nirmala Raniga, addiction specialist.